Dr. Yeesh from the HFY medic order had treated many species during the war. He had helped soldiers burned by acid, reattached arms and legs lost in zero-gravity explosions, and once saved an Okari scout's life using only heat tape and a scalpel. He knew what pain looked like. He knew how bodies worked. He knew how different species showed they were hurt. Until he met the human. The soldier arrived after being ambushed near the Krelv line. The rescue had been delayed, and he was badly wounded. His armor was partly melted, and the right side of his chest had collapsed under cracked plating. 2 field medics carried him in and placed him on the emergency table as voices shouted around them. Vitals dropping. Spine may be damaged. Chest injury confirmed. Urix acted fast. He scanned the soldier's chest, focusing on the broken ribs and swelling inside. The man's blood oxygen was falling. Bruises ran from his collarbone to his hip. Blood had gathered under the skin near his left eye. And through all of it, the man never screamed. Not even once. The human opened his eyes, pale blue, sharp despite the swelling. Urix leaned in, calm but firm. Where does it hurt? The human's voice was even. That's classified. Urix blinked. I am your physician. I require symptom location to proceed with effective triage. No offense, Doc, the human said, exhaling slowly, but I'd rather not give away strategic vulnerabilities. You are bleeding internally. Just a little. You have at least 3 broken ribs, possibly 4. Your left humerus shows stress fractures. You may have organ contusions. Maybe. Urix paused. You are attempting to mask pain levels. I'm compartmentalizing. Urix frowned. That is not a recognized protocol. What is your name? Sergeant Noah Pierce, United Earth Tactical Infantry. And your mission? Pierce smiled faintly. That's classified too. Urix initiated immediate imaging. Scans confirmed his preliminary assessments. 5 fractured ribs, 2 with minor displacement. Left lung partially collapsed, liver contusion, mild spinal torsion. He prepared for surgical decompression. He glanced back. Pierce lay still, breathing shallowly. No grimace, no twitch. The swelling across his chest was spreading, but his heart rate remained improbably stable. Yours couldn't reconcile it. Human resilience is overstated, he muttered. One of the assistants, a young Rakari, spoke quietly. They say humans dull pain to avoid interrogation. Urix looked at the soldier. But why do it here? Pierce's eyes flicked open again. You never know who's listening. The procedure began with local anesthesia. Urix explained it would not fully numb the damage, but would dull the worst of the pain. Pierce nodded, eyes unblinking. When the needle pierced the intercostal space, he exhaled once. That was it. No moan, no flinch. Urix made a precise incision near the lower rib, inserting the pressure drain. Blood pooled immediately. Lung inflation began. The monitor showed gradual improvement. Pierce closed his eyes again. Not from pain, from focus. Urix paused. You are using mental override. Pierce didn't reply. Urix checked vitals again. Your body is not stable. You should be unconscious. I've had worse, Pierce murmured. Urix stiffened. You should not be awake. Guess I didn't get that memo. Urix stared at him. Why? Because, Pierce whispered, some pain isn't there to be avoided. It's there to keep you sharp. Recovery was ordered in a darkened chamber, away from the main med bay. Urix insisted on a longer stabilization period than protocol allowed. The human would not sleep, though sedation was authorized. He sat up slowly, leaning on one elbow despite the muscle strain. Urix returned, annoyed. You are delaying your own recovery. Pierce shrugged with his good shoulder. Movement prevents clots. You should be immobile. That I wouldn't know who walks in the door. Urix studied him for a long moment. This is not a battlefield. Pierce met his gaze. That's what you think. Urix sighed. You cannot heal if you do not rest. I can't rest if I can't trust the silence. Urix turned, left the room, and began researching. deeply. Psychological resilience conditioning, human adaptive trauma suppression, the controversial concept of pain weaponization in Earth Special Operations training. The term kept appearing, controlled pain retention. He returned to Pierce the next morning. I read your files. Earth military doctrine? Not all of them, I hope. Your people teach recruits to reinterpret injury as sensory data. You link pain to awareness, not suffering. Pierce nodded. It doesn't make it easy. It just makes it useful. Eric sat beside him. I thought you were arrogant. I'm not. I thought you were hiding weakness. I am, but not from you. Then from who? Pierce's voice was quiet. Everyone else. He lay back, finally still. Urix changed the monitor's sensitivity, adjusted the pain management thresholds. He didn't argue anymore. He just watched and listened, because now he understood. Humans didn't always hide pain to seem brave. Sometimes they hid it because if they didn't, it would be used against them. And sometimes they hid it because even pain, when properly shaped, could become a blade. Dr. Yiek had patched up dozens of humans before, but none quite like Sergeant Noah Pierce. Most of them followed the same rough pattern: discomfort masked by sarcasm, pain dulled with bravado, and a clear threshold when even the toughest soldier finally admitted they couldn't move their leg, or breathe deeply, or laugh without hurting. They cracked, eventually. Pierce did not. After 3 days in recovery, his scans showed slow but promising improvement. The fluid had drained from his left lung, allowing better inflation. The displaced ribs were pinned and stabilized with internal scaffolding, though swelling remained significant. Liver bruising was monitored hourly, but had not worsened. The stress fractures in his humerus remained his lowest priority, though the man had clearly re-injured it by attempting to lift his cot without permission. Urix had caught him mid-movement. Why are you sitting up? The support matrix hasn't reset your thoracic arc. Pierce grunted, lowering himself reluctantly. I needed a better view of the corridor. You are not in combat. Pierce looked at him with eyes that didn't quite believe that. I'm not on leave either. Urix walked around to the monitor and adjusted Pierce's IV rate. You humans treat recovery like a weakness. We treat idle time like an opportunity for ambush. You believe being vulnerable is unacceptable. No, Pierce said, more softly. We believe showing it makes us expendable. Urix had no reply to that. On day 5, another patient was admitted to the same recovery ward, a Nokari officer, young and alert. He had suffered a minor concussion and moderate cranial bruising after a failed maneuver in 0G. Urix assigned him to the far bed 20 meters from Pierce. The Nokari asked, curious, is that the human who refused to answer diagnostic questions? Pierce didn't turn his head. Still here. You were unconscious when they brought you in. I know. Then how do you know where here is? Andi sound? The Nokari paused. You mean you memorize the air currents? Footsteps, too, and the way your bed squeaks when you shift. The Nokari stopped moving. Pierce finally turned his head just enough to see him. Relax, I'm just trained to observe. That's not personal. Urix watched the exchange with interest. Pierce hadn't boasted. He'd simply stated a fact. Pain hadn't dulled his awareness. If anything, it had sharpened it. Later that day, Urix invited Pierce to a diagnostic review. Not to test his physical limits. To test something else. He presented Pierce with a sensory calibration module. It delivered tiny impulses of heat, pressure, vibration. Standard protocol used it to detect nerve damage. Urix adjusted the thresholds deliberately low, enough to register discomfort. Pierce sat with the panel attached to his forearm. He did not flinch. I am increasing stimulus, Urix warned. Pierce nodded. After the 4th stage, Urix saw micro-twitches in the eye muscles. Normal signs of pain response. Still, no complaint. I am required to assess your pain threshold, Urix said. Pierce smirked. You could just ask. Where does it hurt the most? That's classified. Eric's leaned forward. No one else is listening. You are, and I am not the enemy. Pierce's smile faded. Pain isn't about the enemy. Then what? It's about memory. Eric's was quiet. Pierce continued, voice low and steady. Pain is where we hold the things we can't let go of. Sometimes it's physical. Sometimes it's things we saw. People we lost. If we open the door too wide, it spills out. So you close the door. Not always. Sometimes we just learn to walk around it. Eric's turned off the module. Your nerves are intact. Good to know. Your restraint is abnormal. Try raising a squad in the lower Andes during winter training. This is a spa by comparison. Eric's did not smile, but he believed him. That night, Eric's reviewed Pierce's trauma log. It was redacted. Even with high-level clearance, most of the mission details were blocked. But what he could see painted a grim picture. Multiple high-risk extractions, 2 confirmed captures and escapes, significant exposure to chemical burns and shrapnel, only 1 incident of sedation, during which Pierce woke mid-procedure. Eric's closed the file. This man wasn't just resisting treatment. He was adapting to it. By the end of week 1, Pierce was standing. Slowly, carefully. Eric's caught him walking the corridor, arm pressed tight to his side, breath short. You are not cleared for unsupervised movement. I'm cleared for oxygen recalibration, Pierce said. You said it yourself. Not pacing. I'm not pacing. You are tracing the layout of this wing. Pierce looked unashamed. Standard orientation? Are you planning to escape? Pierce blinked. Only if I'm given a reason. Eric's walked beside him, reluctantly impressed. You realize most patients beg for sedation during your level of recovery. Pierce stopped. I don't sedate. Am I? Because pain tells me I'm still in the fight. Eric's looked at him long and hard, then said, Perhaps you've been in the fight too long. Pierce gave him a long, unreadable look. Probably, and kept walking. By the 2nd week of recovery, Sergeant Noah Pierce had become a fixture in the medical wing, moving slowly and methodically between corridors, monitoring every new face. Some of the junior med techs whispered that he didn't trust anyone. Others said he was just preparing for an escape he'd never attempt. Only Dr. Urix understood the truth. Pierce was still in survival mode. His injuries were healing. The lung had fully reinflated, the ribs reinforced by bone mesh and stabilized under a tight compression wrap were finally knitting. His left humerus showed callus formation across the fracture lines. Pain levels remained moderate, but Pierce still declined sedatives. I need clarity more than comfort, he'd said flatly. Urix had stopped questioning him about that. What puzzled him now was how sharply Pierce's mind remained tuned to every detail around him. He logged every shift change. He remembered what each nurse drank in the break room. He had mapped the timing of the door lock cycles without ever touching a panel. One evening, Urix brought it up. You are no longer in the field. You are under protection. Pierce adjusted the elastic wrap around his torso, careful not to disturb the healing tissue. No one's ever under protection, just surveillance with better branding. That is not a healthy mindset. No. But it's the one that's kept me breathing. Urix watched him recheck his posture, wincing only slightly when his scapular tissue pulled too tight. You're still in pain. Pierce didn't deny it. You could report it. I could. Then why haven't you? Because the second I admit it, someone might decide I'm not ready for reactivation. Urix blinked slowly. You wish to return to service? Pierce met his gaze evenly. I'm not done. But you are broken. Not permanently. Urix exhaled, letting the weight of that settle. Pain is not weakness, Pierce added, but showing it at the wrong moment can be. Days passed. Pierce's scans improved. His blood work stabilized. Scar tissue began to form around the impact zones. He began light training under Urich's supervision, stretching, resistance bands, balance drills. He never overexerted in front of others. But Urich saw the sweat behind his neck, the way his hand trembled slightly after a prolonged plank hold. He pushed until the threshold, and stopped just short of collapse. It wasn't pride. It was training. Every movement calculated, every word measured. On the 8th day of PT, Urich paused their session. "Tell me," he asked, "how many times have you been wounded like this?" Pierce sipped his rehydration gel and leaned against the wall. "This bad? 5, maybe 6. "And each time you recovered without assistance?" "No, but each time I recovered faster than they expected." "That does not mean you are healed." Pierce looked down at the floor. "No. It just meant I could still function." Urich paused, choosing his next words with care. "You hide your pain so well that your own side might forget you ever had it." Pierce looked up and didn't disagree. The moment of shift came when a shuttle from the Earth Coalition docked at the outer bay. A commander stepped into the med wing, tall, crisp, eyes like flint. She greeted Pierce with a brisk nod. "Sergeant?" He straightened. "Ma'am?" Dr. Yerkes observed their exchange. She read from a pad, spoke clinically. "You were deemed field-ready 3 days ago, but delayed your return. Any reason?" Pierce didn't respond immediately. Then, "Still watching for things I might have missed." She raised an eyebrow. "You've got a clean report, and a reputation for returning early. I needed to verify that the doorways here don't kill me in my sleep." That got a flicker of a smile. "We need you back." "I figured." "You're cleared, but the decision's yours." Pierce turned to Urich. The alien doctor folded his arms. "You will not heal further without rest. But I sensed rest is not what you came for." Pierce gave him a long look. "It never was." He turned back to his commander. "Prep my gear." She nodded. "Transport leads in 12. He followed her out without limping. Afterward, Urich sat alone in the ward, reviewing Pierce's data logs. Vitals, imaging, progress. The one thing he added on his own, a profile note. Subject exhibits adaptive pain integration with strategic application. Emotional suppression high. Functional output near optimal. Then, under behavioral analysis, he added a sentence of his own. This human weaponized pain, not to inflict it, but to carry it. Dr. Yerkes received the message nearly 3 months after Sergeant Noah Pierce walked out of his medical ward. The transmission was brief, encrypted, and bore the official Earth Coalition header. It simply read, "Medical clearance acknowledged. Deployment complete. Unit survived engagement. Subject, SGT Noah Pierce 1772E. Outcome, mission success. Status, returned with minor trauma. Resuming standard rotation. No elaboration, no gratitude, just confirmation that the man had once again endured something he shouldn't have." Urich stared at the screen, then powered it down. He had treated many soldiers. Most wore their injuries like badges or shields, but Pierce had worn his like armor made of glass, transparent, hard-edged, and always ready to shatter if handled the wrong way. Still, it hadn't, and that alone stuck with Urich. Another month passed. War cooled. Borders shifted. Treaties stuttered into life. Then, one morning, without ceremony, Pierce returned. No stretcher this time. He walked under his own power, left arm in a sling, jacket slung casually over one shoulder. A scar curved down the side of his jaw, pink and healing. His posture, though relaxed, still hummed with quiet tension. Urich met him at the threshold of the medbay, arms folded. "You're injured." Pierce looked down at his sling. Cracked scapula, nothing dramatic. "You didn't need to return here for that." "I didn't come for treatment." Urich gestured toward the nearest cot anyway. "Sit." Pierce obeyed. He wasn't limping, but he moved carefully, like his frame was a house of cards and every step risked a collapse. "I read your mission report," Urich said. "Classified. Pierce replied automatically. Eric's ignored it. You lost your squad. Pierce nodded once, all but one, and still you returned to duty. Again. That's the job. Eric studied him. Why are you here? Pierce looked around the room, quiet, sterile, unchanged since his last stay. His eyes settled on a corner table where a half-used pain assessment scanner sat. I wanted to talk. Eric's raised an eyebrow. A human soldier wants to talk? Off record. Eric's walked over, dimmed the lights, and sealed the door. Pierce didn't begin immediately. He took a slow breath. His hand clenched the edge of the cot. You were right, he said finally. I don't rest. I don't stop. Because pain makes you sharp. Pierce nodded. But lately it's making me heavy too. Eric stepped closer. You've carried too much for too long. I can't unload it. If I drop it, someone else will pick it up, and maybe they're not strong enough. Eric didn't interrupt. Pierce continued, his voice quieter now. There's a moment in the field, always the same. You're hurt, not dying yet, but you feel it setting in. Bones screaming, muscles locking, vision swimming, and someone calls for help, and all you can think is, if I slow down now, they die. So, you don't slow down. No, I lean in. And no one ever sees that. They see the outcome, not the cost. Eric sat beside him. Then let someone see it now. Pierce laughed once, bitter and short. You're not military. No, Eric said. I'm worse. I'm a doctor. I can't fix what I can't name. They sat in silence. Finally, Pierce spoke again. I remember everything, every wound, every scream, my own and theirs. Eric didn't write anything down, didn't scan him, just listened. I once told you pain is information, Pierce said. That's still true, but sometimes it's a story too, one you can't stop reading even when you want to. Eric asked, do you want the story to end? Pierce shook his head. I just wanted to change chapters. Eric reached for the sling, gently unfastened it. Then let's begin with this one. He ran a scan over the shoulder. Ligaments were strained, bone was healing, nerve activity showed no lasting damage, a minor injury by human combat standards. But Eric saw more. In the way Pierce's breath stuttered, just once. The way his hands twitched when he closed his eyes. Treatment protocol? Eric asked, returning to his console. Pierce looked up. Whatever you recommend. It was the first time he had ever said those words. Over the next several days, Pierce stayed on base. Not because he had to, because Eric asked him to. They didn't talk about the field, not directly. But every evening, Pierce helped reorganize the med archive. He fixed a loose seal on the thermal incubator. He rewired the diagnostic bay's power coupling twice. I can't sit still, he said when asked. I know, Yeeks replied, but he let him stay. Because sometimes healing wasn't about silence or solitude. It was about being in a place where you weren't required to hide the weight you carried. When Pierce finally left, he didn't say goodbye. He just handed Eric a folded sheet of paper. Eric opened it after the shuttle departed. On it, a handwritten note. Not all pain needs to be visible to be understood. Thanks for seeing mine, anyway. Signed, Pierce. Eric kept the note. He returned to treating patients. But he adjusted his approach. He asked where it hurt. Still. But he also asked what they feared, what they remembered, what they chose not to say. Because humans, he had learned, didn't always use pain to show strength. Sometimes they used it to keep themselves from falling apart. And sometimes they shared it not as weakness, but as trust.